All right, welcome. Today we're putting on our detective hats, and our case file, it's all about the human eye. We're going to dive in and see how just one single image of the eye's orbit can unlock some incredible secrets hidden deep inside the body.
I mean, think about it. What if an eye could tell a story, not just about what it's seeing out in the world, but a story about what's going on inside the body? Well, it turns out it absolutely can. You got to know how to read the language.
You know, in medical imaging, every single little detail is a clue. A tiny shadow here, a little bulge there. They're all pieces of a much bigger puzzle. And our job today? It's to learn how to spot those clues and, well, solve the case.
Okay, so when it comes to problems in the eye's orbit, the very first most important question a doctor asks is super simple. How old is the patient? Seriously, the answer to that one question pretty much splits all the possibilities right down the middle. So let's start with the kids.
Okay, first up is something called retinoblastoma. This is the most common primary eye cancer in children, and we're usually talking about kids under the age of 3. But here's the thing. It has one single knockout clue: calcification. If you see calcification inside a kid's eyeball on a scan, it is almost a guarantee that you're looking at retinoblastoma. It's that powerful.
But of course, it's never that simple, right? There are always going to be lookalikes. And a big one here is something called Coates' disease. It can look really similar at first glance, but luckily there's a key difference that helps us tell them apart.
And this is where the real detective work comes in, and it's actually pretty cool. With retinoblastoma, the eyeball is either normal-sized or even a little bigger, and you've got that telltale calcification. But with Coates' disease and another one called PHPV, the eyeball is smaller and, this is key, there's no calcification. Just two simple things to look for: the size of the globe and whether or not there's calcium, and bam, you can solve a really complex puzzle.
So, that's the world of kids. Now, let's totally switch gears and talk about adults. The whole game changes. For adults, the most common thing you're going to find inside the eye is melanoma. And just like retinoblastoma had its signature clue, melanoma has a classic buzzword, a special name for how it looks. If you ever hear a radiologist mention a collar button, they're almost definitely thinking about melanoma. So what on earth is a collar button shape?
Well, it's all about the shape. The tumor literally pushes its way through a tough little membrane in the eye, and as it does, it kind of mushrooms out. That creates this classic collar button appearance. And when you see that on a scan, it is a huge clue that points right to the diagnosis.
All right, let's talk about one of the biggest challenges in this field: telling the difference between a dangerous tumor and just inflammation. You know, the body's own defense system going a little crazy. They can look so similar, it's wild. But thankfully, the clues they leave behind are very, very different.
So on one side, we have something called orbital pseudotumor. We don't really know what causes it, it's just inflammation. But the number one clue, the big one, comes straight from the patient. It hurts a lot. And when you look at the scan, you see that the inflammation involves the entire muscle, right down to the tendon where it hooks onto the bone.
Now let's look at its imposter: thyroid orbitopathy, which you often see with Graves' disease. This is actually the most common reason for bulging eyes. But here's the contrast. Unlike pseudotumor, this is typically not painful. And the scan looks different too. It has this signature appearance where only the big, bulky part of the muscle, the belly, swells up, but it leaves the tendon alone. So you've got pain versus no pain, and the whole muscle versus just the muscle belly. Those are the clues that let you tell these two apart.
But wait, there's more. Thyroid orbitopathy has another trick up its sleeve. It follows a super predictable pattern. The inflammation hops from muscle to muscle in a specific order, and there's a great mnemonic to remember it: I'm slow. It starts with the inferior rectus, then the medial, then superior, lateral, and finally the obliques. I'm slow. That predictable path is another huge piece of the puzzle.
Okay, let's zoom in now and focus on one of the most important parts of this whole system: the optic nerve. Think of it like the main data cable connecting your eye to your brain. So you can imagine, when something goes wrong here, the stakes get really, really high.
So there are really two main tumors we see in this area. First is an optic nerve glioma. That's a tumor that's growing from the nerve itself, which makes the whole nerve just swell up and get bigger. You usually see this in younger folks. Then you have a meningioma. This is different. It's a tumor that grows around the nerve, kind of squeezing it from the outside.
And hey, guess what? Just like we had the collar button for melanoma, meningioma has its own classic, unforgettable buzzword. It's a visual clue that's so spot on, it basically screams the diagnosis at you.
They call it the tram track sign, and it's exactly what it sounds like. On the scan, you see these two bright parallel lines running along both sides of the optic nerve, just like a set of train tracks. It's the perfect visual for a tumor that's wrapping around the nerve instead of growing inside it. You see that tram track sign? You're looking at a meningioma. It's that clear.
All right, let's do a quick lightning round of a few more really interesting cases. These have clues that are so classic and memorable, you'll probably never forget them once you see them. First up is this: raccoon eyes. I mean, wow! What do you think could possibly cause something like that?
So this is actually a clinical sign of something called metastatic neuroblastoma. It's a type of cancer in kids that has spread to the area around the eyes. The tumor gets into the soft tissues, and that's what causes this really distinct bruising. It's a huge clue that you can see without even needing a scan, and it points to a very serious, specific condition.
Okay, now for a really fascinating twist. Almost everything we've talked about that grows in that tight little space of the orbit, tumors, inflammation, you name it, it's going to push the eye forward, right? It causes a bulge. We call that proptosis. But there's one classic rule breaker. A specific kind of metastatic breast cancer does the total opposite. It causes this scarring that actually pulls the eye backward. That's called anophthalmos. So a sunken eye can be just as big of a clue as a bulging one. How wild is that? So, as you can see, making a diagnosis isn't about finding one single magic clue. It's really about being a good detective. It's about gathering all the evidence, the patient's age, what they're feeling, and all these classic signs we've seen on the images, and then piecing it all together to tell the complete story.
Let's do a quick recap with this snapshot. Patient's a kid with calcification, you're thinking retinoblastoma. An adult with a collar button shape, that's melanoma. You spot that tram track sign on the optic nerve, it's a meningioma. A painless bulge that leaves the tendon alone, that's thyroid orbitopathy. And that one weird case of a sunken eye, that's a huge clue for metastatic breast cancer. See? Each one has its own unique signature.
And that brings us full circle. You know, we've all heard that saying that the eyes are the windows to the soul. Well, what we've seen today is that for a doctor, for a radiologist, they're a window into something totally different. They're a window into a complex world of medicine, where every little detail tells a story. And it just makes you wonder, what other stories are out there hiding in plain